This presentation is the systematic review of the utilization of gastric ultrasound to limit perioperative aspiration risk for patients taking glucagon-like peptide-1 receptor agonist. This is a doctoral scholarly project presented by Dustin Bergeron and Ryan Miller. This research was based on the increased use for glucagon-like peptide-1 receptor agonist being used for weight loss. So how does GLP-1 work? It inhibits peristalsis in the stomach, increases tonic contractions in the pyloric region, potentiates insulin release, and reduces glucagon concentration. Its mechanism of action used for weight loss is due to the decreased appetite, which further leads to reduction in body weight over time. While there are long-acting and short-acting GLP-1s, the longer-acting GLP-1s are more commonly used for weight loss management. While there is a limited side effect profile of these drugs, nausea and vomiting are the most common complaints from patients. A dangerous phenomenon seen in surgical patients undergoing anesthesia is the risk of pulmonary aspiration. Aspiration makes up 50% of airway-related mortality and is associated with a 20% incidence of all in-hospital mortality. So how is aspiration and GLP-1 agonists related? The delayed gastric emptying that leads to a reduction in body weight actually presents a risk for pulmonary aspiration due to the residual gastric content. Standard preoperative fasting guidelines put in place may be irrelevant for patients taking GLP-1s. With advancements in technology, a new technique known as gastric point-of-care ultrasound has been used to visualize and assess residual gastric content preoperatively. Therefore, this is a possible solution to avoid pulmonary aspiration with anesthesia. However, currently it's not widely adopted due to its novel use. The theoretical framework of this systematic review is based on Lewin's change theory. This theory is a simple three-step model. The first step is unfreezing. This is when any problem is identified and you address any resistance to change. The second step of moving is when the new process or approach is introduced into practice. The final step of freezing is when that new process is established as the new standard. Lewin's change theory is an effective model to identify problems and implement changes for improvement. The benefit of this model for utilizing gastric ultrasound is that this is a new technique, and many providers are unfamiliar with and hesitant to implement. With the risk of aspiration increasing for patients taking GLP-1s, the use of POCUS can assist in mitigating these risks for the patient population throughout the entire perioperative phase. The objective of this review is to investigate gastric POCUS's role in limiting pulmonary aspiration risk and to promote better post-op outcomes for patients taking GLP-1 receptor agonist. The criteria for the inclusion of participants in this review were adult patients over the age of 18 and were currently prescribed GLP-1 agents. Trauma patients and emergency surgery were excluded due to their status of full stomach at baseline. Interventions included in the review were uses of ultrasonography to identify residual gastric content, and fast exams were excluded. Outcome measurements included in this review were documented predicted risk of aspiration or known incidences of aspiration. However, occurrences of aspiration during or after the PACU phase were excluded from review. With the limited evidence and research currently, all peer-reviewed study methodologies were included in the review. This decision was made to optimize search results to find as much supportive literature as possible. A structured literature search was conducted in September of 2023. The databases used in this search included Medline Complete, CNOL Complete, ProQuest, Central, Embase, and Ovid. The search yielded 129 articles, and an additional 17 articles were identified by reviewing the reference list of relevant articles and a recent practice guidelines statement from the American Society of Anesthesiologists. The literature search utilized the same search terms across all databases used. The additional search terms were variations, including specific and broad variations of glucagon-like peptide-1 receptor agonist, gastric POCUS, and perioperative aspiration risk. The preferred reporting item for systematic reviews and meta-analysis guidelines were utilized to guide the inclusion and exclusion process of the literature search. Initially, 130 potential articles were screened based on the inclusion and exclusion of relevancy based on the proposed research question. 115 of these articles were excluded, and the remaining 15 articles were appraised by utilizing the Joanna Briggs Institute checklist. During the appraisal process, one additional article was excluded. The students agreed that this article would be excluded due to testing an intervention that was not aligned with the research question. A finalized total of 14 articles were included in the systematic review.
After performing a thorough and exhaustive systematic review, a gap in literature was identified. Only one article was found to directly relate to the research question proposed. 13 related articles included a focus on a single component of the research question. The one article that directly related to the question was conducted in 2023 by Sherwin et al., and in that study, their gastric POCUS identified that 90% of patients on GLP-1 agonists that were participating in the study had full stomachs after completing NPO guidelines. While only one study was directly related to every component of the research question, it was pertinent that we thoroughly investigated and analyzed related literature as well. One theme that we found with related literature was practice guidelines for fasting requirements, pharmacological agents, and the management preoperatively with GLP-1 agonists. American Society of Anesthesiologists Task Force on Preoperative Fasting and the Use of Pharmacologic Agents to Reduce the Risk of Pulmonary Aspirations is what was used to establish the updated NPO guidelines for preoperative patients. And then Joshi, Abdulmalak, Weigel, and Harbaugh et al. In 2023 provided recommendations for clear liquid consumption prior to NPO times. Another study by Joshi, Abdulmalak, Weigel, and Soriano et al. Provided recommendations for preoperative management for patients taking GLP-1 receptor agonists. Likewise, in 2023, Jones et al. Provided recommendations for GLP-1 receptor agonist preoperative managers with the use of POCUS gastric ultrasound. Another theme that we found relevant in the related literature was case reports where patients either had an incidence of regurgitation under general anesthesia or MAC anesthesia. And the big takeaway point was that these patients all were on GLP-1 receptor agonists. Fujino et al. In 2023 showed a case study where a large amount of gastric volume were identified during EGD after roughly 10 hours of fasting. The patient didn't have an episode of regurgitation or aspiration, but it was found to have a large amount of volume in the stomach. Gulak and Murphy in 2023, there was a case where a patient actually had an incident of pulmonary aspiration after induction of anesthesia, and as well as Klein and Hobai in 2023, where there was a case of pulmonary aspiration during an EGD, where the patient ended up being on a ventilator and sent to ICU. Another thing were the effects that GLP-1 receptor agonists have on gastric emptying. There were 5 studies in total that played pivotal roles in showing physiologic changes or measurements of gastric emptying that showed evidence that GLP-1 receptor agonists did indeed decrease the rate of gastric elimination. Fredrickson and all in 2021, there was no evidence of delayed gastric emptying using paracetamol absorption, which in the study did note that was an indirect measurement, which could have been a limitation in the study. Gerbstedt et al. In 2018 showed that GLP-1 receptor agonists slowed gastric emptying in a variable but marked manner acutely. Gabori et al. In 2023 showed that the gastric residue was significantly higher with GLP-1 receptor agonist patients during EGDs. Silveria et al. In 2023 showed that there was a correlation between the use of GLP-1 receptor agonists and gastric residual content. And then Stark et al. In 2022, there was no differences in EGD outcomes with GLP-1 receptor agonists when matched to cirrhosis or diabetes. The last theme we saw was the use of gastric POCUS to assess preoperative aspiration risk. So in 2019, Charlesworth and Wiles released a expert opinion, and throughout their study, they talked about the use of POCUS gastric ultrasound to assess pre-op aspiration risk. However, there was insufficient data to prove a benefit to patient safety. After completing a thorough and exhaustive systematic review, we've concluded that there was currently not enough evidence to definitively answer the research question that was proposed. However, there is an there's clear evidence that a GLP-1 receptor agonist slow gastric emptying and pose a risk for pulmonary aspiration for patients undergoing anesthesia. Throughout the process of completing the systematic review, we've noticed limitations and possible challenges that we identified. There was only one study that's directly related to the research question. Many studies assessing the effect of gastric emptying used indirect forms of measurement of residual gastric volume, which could have hindered results. And then, ideally, there's just not enough data available on the topic at hand. Some strengths, however, that we did notice is that many related articles contain direct observational reports of aspiration while patients were on GLP-1 receptor agonist therapy. The review contained a broad selection of study designs with various sample sizes and populations that we also believe was a strength of the study. What we as authors can recommend is that there's just more evidence must be provided to answer the research question proposed. Further integration of gastric POCUS into practice could also benefit as well. Current recommendations allude to the benefit of its use, but there's a limited amount of use and limited amount of evidence to support that. Final recommendations would be to follow the published recommendations provided by the American Society of Anesthesiologists, where that is to utilize a rapid sequence induction if a dose of GLP-1 receptor agonist cannot be held, and possibly utilize gastric ultrasound to assess gastric volume characteristics preoperatively. Regarding implications for practice, based on the current literature as well as the increased usage of these medications, a practice change is needed to prevent those pulmonary aspiration incidences in patients taking GLP-1 receptor agonists. However, there's not enough evidence at this time to support a specific change, but we should continue to treat these patients taking these medications as possible full stomachs and treat them with full stomach precautions. That's whether we're performing our RSIs, or rapid sequence inductions, or delaying non-urgent procedures requiring general anesthesia. Implication for research is kind of where we thought was the largest takeaway from the systematic review. There's tremendous opportunity for multiple studies to be performed regarding gastric POCUS and its use for preoperative management for patients taking GLP-1 receptor agonists. A randomized control trial is ideally the best study design to construct a study for, but however, it puts us in a weird position, putting ethical problems and ethical concerns, putting a group of patients at risk of pulmonary aspirations. However, we believe that additional research could be performed on the utilization of gastric ultrasound to determine its credibility as a true preoperative risk assessment tool for patients not only taking GLP-1 receptor agonists, but as well as all patients.